Good morning, everyone. My name is Victoria Martin. I'm the Regional Director in Latin America and the Caribbean for Hope and Homes for Children, a global organisation whose mission is to catalyse the elimination of institutional care of children worldwide. I'm speaking to you here today as in our joint initiative with RELAF, we're joining forces with all of you to make a call to never again witness such a tragedy as in Guatemala at Hogar Seguro. That never again children and young people should experience such grave violations of their rights, and that never again should children have to grow up in institutions because the systems that are meant to protect them have failed to provide suitable family and community-based alternative care. In Guatemala, the efforts of the national authorities, UNICEF, agencies and NGOs on the ground to respond to the tragedy at Hogar Seguro must be recognised. In June last year, I spent time with the dedicated and passionate people who are not only implementing critical short-term responses with measures such as emergency placements and psychosocial support to children, but who also want to build a vision for systemic, longer-term reform that's not only responsive to the tragedy, but also proactively addresses the structural and long-term road ahead to reform the child protection system. As an international community, we are here to support those processes, to support the development of meaningful national strategies and strong but flexible systems that meet children's individual needs. It's important that we focus squarely on the root causes and recognise that this is a regional and indeed a global problem. It's estimated that between 2 and 8 million children are living in institutional care globally. Now, residential care is still the predominant response when it comes to caring for children affected by different complex social and family circumstances, such as being part of an ethnic minority, migrant families, families with children with disabilities, as well as children from communities affected by poverty, marginalisation, violence, armed conflict, natural disasters. This response reinforces discrimination, and that has to change. The good news is that there's a growing momentum towards de-institutionalization and child protection system reforms, not least with the implementation of the UN guidelines on alternative care. Transitioning from institutional to family and community-based care is much broader than purely closing existing institutional care facilities. The goal really is to transform the whole national child protection and care system. It's a cross-sectorial process, linking the reform of social, healthcare, education, child protection and finance systems together, so that the one-size-fits-all solution of institutional care is replaced by holistic programs that aim to prevent the need for institutions and unnecessary entry to alternative care, to progressively eliminate unsuitable forms of care, such as institutions, and in parallel develop a range of appropriate family and community-based care services that match the needs of each individual child. This is how we can put the best interests of each and every child at the centre of any solution. Now, these reform processes are happening worldwide, from the implementation of the Tracking Progress tool in Costa Rica to monitor the implementation of the UN guidelines on alternative care, through to whole-scale reform processes in countries like Romania, Ukraine, Rwanda, where the number of children living in institutions has been dramatically reduced through sustainable childcare reform programs. Only last week we were hearing about the reforms in Nicaragua too. Our own experience demonstrates that ensuring family and community-based care for every child is possible, and it has better outcomes for children. The question, of course, is how do we create the conditions for change so that de-institutionalization can happen globally but on a national level too? Well, our experience across many countries and many contexts tells us that there are 4 key preconditions for change. These 4 key ingredients are at the heart of our theory of change, and they can form the pillars of a comprehensive childcare and protection system. First of all, we have evidence and know-how. Those models and evidence must be generated and used to inform policy and practice. Secondly, sustained political will is absolutely critical at the highest level, with strategic vision complemented by a strong legislative and policy framework, intersectoral coordination, and a national strategy that lays out concrete actions and milestones to deliver reform. Thirdly, a strong national social workforce and a coordinated civil society, building the technical capacity and sustainability of a strong professional social workforce at all levels that's trained and supported to deliver the transition for children is a critical component of the process. Active and organised civil society is a key driver of reform too, as you're all showing in this room here in this webinar today, not only by developing know-how and innovative projects, but through advocacy and accountability. The fourth factor that's critical in this process is sufficient and appropriate financing. Donor funds, whether that's funding from governments or development partners or faith-based organisations, really should no longer be used to build, renovate or support institutions for children, but instead needs to be reinvested to ensure that children grow up in safe and loving families, that they have access to family support, that they have access to early childhood development services, inclusive education, health and social services in the community. Investment in structural reforms of the child protection system need to be prioritised, and additional funds are needed during the transition process, as well as the ongoing resources to be allocated for the sustainability of the system. Right now, institutions are draining resources from the system to maintain themselves, and those resources like staff and budgets, which need to be transferred to foster care programs, prevention, and other family strengthening and alternative care services. These ingredients aren't just about de-institutionalization, they're an entry point to broader child protection system reform. By stimulating effective investment in children, the development of a professional workforce, fostering interministerial coordination and promoting a child-centred agenda, the transition from institutional to family and community-based care can be an avenue to strengthen the child protection system as a whole. I'd like to come back briefly to the principles of necessity and suitability outlined in the UN Guidelines for Alternative Care of Children. Now, these principles guide us to always ask, is alternative care outside the family genuinely needed? Now, necessity means preventing conditions that can lead to separation, such as material poverty, discrimination, violence, access to reproductive health services. The suitability principle then means that alternative care is provided in a way matching the individual needs and circumstances of the child. For this, we need a range of family-based care settings so that there's a real choice and so that the option can be provided in the best interest of the child at that specific time, not only because it's the only service available, but because it meets the best interests of the child. Gatekeeping mechanisms, service development, building the capacity of the workforce, these are all key to applying these principles of necessity and suitability faithfully and skillfully, and they undoubtedly result in the better outcomes for children. Finally, let me remind all of us to ask children and young people what they want. Children everywhere have told us that they want to live in families, not institutions. The girls in Guatemala tried to use their voices. Now is the time to listen to them and encourage their voices to guide the policy responses, the programs, the investments that national governments, development partners and donors make in children and young people's lives. And I do hope that we can hear some of those voices from children and young people this morning. Regrettably, this moment marks 1 year after the loss of young lives in Guatemala. We stand together with so many partners here today from the international community and especially from Guatemala to remember them and to call for a coordinated and purposeful approach to the gradual elimination of institutions and a path towards realising children's rights. Thank you.